Good morning, everyone. My apologies for being late. Good evening and welcome to the Thursday, June 2nd Reparations meeting. We'll go ahead and call the meeting to order. We do have a quorum. First up, approval of minutes. Is there a motion?
So moved.
Second.
It's been properly moved and seconded. Are there any edits or corrections? Seeing none, all those in favor of passing the meeting minutes, please signify by saying aye.
Aye.
All right, that motion passes. Thank you. Next up, we have communications, item A.
Good morning, committee.
Good morning.
Tashika, assistant to the city manager. So as of June 1st, the city received $69,303.79 in the reparations donation fund. So that's a $50 increase in April.
All right. Any questions? Seeing none, is there a motion to accept and place that on file?
So moved.
Second.
It's been properly moved and seconded. All those in favor, please signify by saying aye.
Aye.
All right, motion moves forward. Next up, we have a report. Remember Ambassador Simmons?
Oh, thank you. There are very few updates, but before that, I think we all want to just offer our condolences and support to you and your families during this time of bereavement, and we are sending up prayers and well wishes for you.
Thank you. Thank you. Thank
Honorable
you.
Braithwaite lost his mother in the last week. Services are tomorrow, and it's really incredible that he's here in service today.
Thank you. Thank you very much.
There are very few updates, but one major update in the national movement for reparations and passing HR 40, and that is a call to action for executive order for HR 40 to be signed by President Biden. Congresswoman Sheila Jackson Lee, who's the lead sponsor on that bill, is asking for all supporters to send letters, emails, advocate, hold rallies, because the hope is that by Juneteenth, HR 40 is signed by executive order. There was a virtual rally that was yesterday, and the national leaders of NAACP, Urban League, and other national institutions participated along with Congresswoman Jackson Lee and Congresswoman Barbara Lee. And so if you would like to view that rally or learn more about that, you can view it at reparationscom.org, which is the website for NARC, or on their YouTube channels. And in local updates, there is a lot of attention given to two recent reports. One is the state of California has released their report and study on reparations, and Harvard University also released their findings, their initial report, and a $100 million commitment to reparations. And then in our own community, the interfaith community continues to just really step up. And I want to give information on I just put it in my email. On the 13th of June at Fountain Square, the Evanston's Interfaith reparations effort will launch at noon. And it's reparations, reconciliation, and repair. More information can be found, I imagine, on their website. There is a long list of sponsors that I see here, and I understand they have a giving campaign that will launch then and go through King Day of 2023, if I'm not mistaken. Is there someone from the interfaith community here that can maybe share any more details on that? If I got it?
I don't have more details
Okay.
on that.
Okay.
But
Perfect. Perfect. So what we'll do is we can ask the sheet if we upload the flyer to the packet. So if anyone wants to get more information on that, There's another event that I'm aware of, I don't have the details, and I'll have that uploaded as well. And that's it, unless there were any questions, it's a long movement, so.
And so if I could just take the liberty to say, because you're being a little bit modest, that this month, our very own former alderman and committee member, for the past 2 years, there has been documentation by Erica Alexander and her film crew, all of the work that she has been leading with this help and support of our city council as well as our community. And there's a documentary in New York this week. Hold on, I'm a little slow this morning.
Yeah.
So can you please share the details that you were going to keep?
Let me make a correction, actually. So it's all the work that Evanston has done. And so pretty much everybody in Evanston is in this documentary. I pre-screened it. I demanded that I be able to see it. But it's really shows from not the beginning of the work. And so I want to set the right expectation. It doesn't show all the work that it took for us to get to that big town hall in 2019, but it starts at that town hall in 2019. And it talks to staff and residents, supporters and disbelievers, and partners that have supported the work. It premieres at the Tribeca Film Festival on June 11th, and a home screening is available on June 13th through the end of the festival, and you can go to the Tribeca Film Festival to get tickets for it. I think the tickets are like $20.
Yeah, I think they're 15 or 20.
Yeah, $15 or $20.
You should, the name of it is The Big Payback.
Yes.
So that's what you should look for.
Thank you for that
Because there's a
verification.
series on, yeah.
Yes. Oh, one more thing that I should add. There is, and I think I said this last time, WTTW PBS Chicago, Evanston Community Foundation, and the Reparations Stakeholder Authority of Evanston will host a panel on reparations and the learnings from it on June 20th. And we'll get the details and also put that on the website because I'm not sure of the time, but look for that as well. Panelists include Saul Anderson of Evanston Community Foundation, Professor Cornell Brooks of Harvard University, Dr. Michael Neighbors, and Dino Robinson. And that concludes my report.
Thank you all, thank you, and I think that's definitely worthy of an applause. All right. Next we have for discussion, and I'm really excited about this. We talked about this at our last meeting. Kristen Meyer, I get that's correct, and we have Director Ike Ogbo in the back, presented this to our city council, so what, about 30 days ago? And it's something that we've talked about throughout the whole movement, just the impact of the systems of racism, everything that Black people have experienced. So I think it's real interesting just to take a snapshot of where we are right now, just as well to all of those many, many years of oppression and all the stuff that you've been talking about. So I don't want to belay this, and I definitely want, do you want to come and tee this up, and then
Good day.
thank you.
Ike Ogbo, Director for the Health and Human Services Department. The E-Plan is a 5-year plan that is established to identify the health issues in Evanston. The former E-Plan that we had expired last year, and we are tasked by the Illinois Department of Public Health to facilitate and establish a current E-Plan for the next 5 years. This is a project that we've embarked on for the past 18 months, even in the midst of COVID, to furnish the reports that Kristen Meyer, who is our community health specialist, will be relaying to the committee this morning. And the information that we'll provide this morning is embedded in data and statistics. And we also sought the input of community leaders professionals in academia, in public health, in medicine, and mental health to establish these criteria and identify what our health priorities are in Evanston that we'll be working on in the next 5 years. So this is not just a HHS, a Health and Human Services document, but it's going to be a document that will provide a view or a guideline in which we are seeking collaborators and community members to help us make effective progress in these health outcomes and desirable health outcomes. The three factors that we identified in the E-Plan, and as I mentioned, we use data and statistics, are mental health, health disparities, and climate resiliency. And the way that we design our E-Plan is that it will be in alignment with a number of city initiatives so that it won't just be an isolated document, that as we're working on other city initiatives, that we'll also have these factors and these protocols that we've already put in place. It is still a documenting process. It has not been finalized. We are hoping that it will be finalized by mid-July, and once that's finalized, that will be provided to our community members, City Council, and of course it will have to be submitted to the Illinois Department of Public Health at the end of it. But Christine, if you can take it away.
Sure.
Thank you.
So as Ike said, I'm Kristen Meyer, the Community Health Specialist. I'm Kristen Meyer, the Community Health Specialist for the Department of Health and Human Services. And I'm going to talk a little bit about our E-Plan, our 5-year community health assessment. As Ike mentioned, this is a requirement of all health departments in Illinois to stay certified in the eyes of the state. But I think more importantly, it can be a guiding process to help us really identify, to dig into the data and really identify priorities. And I think the data will not be surprising to you all, but I think it really provides a burden of evidence that supports all of the work that you all are doing in this committee. So just a little bit about kind of how we framed our community health assessment. So in past community health assessments, we focused on only the city level because that's all, we couldn't dig any deeper in the data. And then also, usually, the way public health used to be done is by really focusing on what's called downstream health impacts. So those are things like burden of disease and then the risk factors that kind of contribute to them. So looking at diabetes and then thinking about what are all the health behaviors that contribute to that. So, lack of physical activity, lack of nutrition, that kind of thing. But what we increasingly understand is that we cannot stop there in understanding what shapes our health. And what actually shapes our health is conditions that are far beyond individual control. So those are things like the physical environment around us, the economic environment, institutional inequities in education, in healthcare, in law enforcement and justice. And because those are the policies and systems and environments that really shape the world around us and the choices that are available to us, that is the area where we've really dug in and focused on how that shapes the downstream data that we do see in our E-Plan. Another way that the E-Plan is a little bit different than past iterations is that we're also taking both a neighborhood by neighborhood approach and also stratifying by race wherever possible so that we can really dig into these within city inequities. So this is a map of life expectancy across the city of Evanston by census tract. And the reason why it's so important to dig into these neighborhood by neighborhood inequities is because when we look at the Evanston average, that really masks the reality of what's happening across our city. So, for example, with life expectancy, the average American can expect to live to about 78 or 79 years old, and the average Evanstonian can expect to live to 82, so a longer life expectancy on average. And if we stopped there as we used to, we might pat ourselves on the back and say, we're doing good, we're healthier than the rest of the country. But then, if we really dig in neighborhood by neighborhood, we can see that these health benefits are not shared equally across our community, and that there are some neighborhoods that are doing quite well, and then some that are disproportionately harmed. So for example, up on the far north side, northeast side, we have Census Tract 8088, where the average resident can expect to live to almost 89. In Census Tract 8092, which corresponds roughly with the 5th Ward, life expectancy is 13 years lower than that neighborhood that's bordering it. So we believe fundamentally that this is unjust and can be corrected because this is driven by systems of inequity that we can repair. And a little bit about kind of, again, how we think about neighborhood by neighborhood health. We know that these inequities that we see in this map did not occur in a vacuum. They came from a history of disinvestment and racism in both our country and our city. So for example, when we look at this same life expectancy map and place it by our old redlining map from 1935, we see a lot of patterns that were put into play nearly 100 years ago that we still very much see playing out. So for example, again, the area with the lowest life expectancy in Evanston, roughly corresponding with the 5th Ward, is the area that was formerly redlined in our city. And the area where we have continued to see concentrated disinvestment and disadvantage. Similarly, the areas that are in blue and green on this redlining map are the areas that banks labeled the most desirable, i.e. the most white. Yes.
Yeah, I just want to ask, I'd love to see this particularly since we're here in the Evanston Reparations Committee, overlaid not with the HULC map, the Homeowners Loan Corporation map. I'd love to see this next to our zoning map and what we are basing our reparations on, because I think that would be helpful for what we're doing here.
Yeah, I think that's a great idea. I'll be happy to do that. So the areas that are in blue and green on this redlining map were the areas that were labeled most desirable and most white and affluent. And we see that those patterns that were put into play still bear out in our map on life expectancy. And unfortunately, all of the maps that I'm going to show you today, so that we in Evanston look good on average, but the reality is that we have areas of concentrated health and wealth and privilege, and then areas of concentrated harm and disadvantage. For anyone who's wondering, again, if these patterns are still in play and if that redlining map has lasting legacy, the answer is, of course, yes. So also when we look by neighborhood, in Evanston, we're looking by race because that history of segregation has really remained. And so in Evanston, we think of ourselves as a diverse community, and we are, but we can see by looking at this map of concentration of where white folks live across the city that white folks and folks of color are not distributed evenly across Evanston. And so we have areas that are over 90% white, and then areas that are almost 10% white. And then, of course, again, when we look at this map compared to life expectancy, compared to burden of disease, again, we see very troubling patterns that are consistent throughout all of this data. So again, thinking about our model of health, really thinking about the physical, social, economic environments around us playing the most important factors in shaping our health and access to choices. We're going to look at a few living conditions. So the first one is median household income. Again, with life expectancy, if we just compare Evanston to the US, we look like we're doing really good. In the US, median household income is about $62,000. In Evanston, it's $78,000 roughly. But again, when we start to look at a neighborhood by neighborhood level, we see, again, striking inequities that really paint a picture of what choices are possible for folks across our city. So again, looking neighborhood by neighborhood, there's over $100,000 difference in median household income by census tract. Formerly redlined area, census tract 8092, median household income is about $44,000. So substantially less than the median household income. Importantly, I don't think my mouse is working here, but the census tract just to the east of that, where median household income is about $30,000. That is an area where that's comprised of about 60% Northwestern students. And so the low income that we see among college students is important, but very, very different than the low incomes that we're seeing in the 5th Ward. And so just wanted to point that out, that they technically have lower incomes, but of course probably are working are probably full-time students and have a very high earning potential likely in the future. And so again, when we think about kind of median household income and why this matters, we can think about all of the limitations that this confers. So if this is the median household income, we think about how much less there is to spend on childcare, on food, on education, on housing. Speaking of housing, we can also, and in the report, we go a lot into housing inequity and risk of displacement. And in census tract 8092, again, where the median household income is about $44,000, about 50% of households are spending at least 30% of their income, if not more, on housing costs. And then a substantial number of them are spending 50% or more of their income on housing, putting folks at a substantial risk of being displaced because of cost of living here. We can also look at median household income by race and again, really see that this average does not tell the whole story and that it's masking huge inequities. So again, median household income in Evanston as a whole, if we just compared it to the gray bars at the bottom, Illinois and US, we would say that we're doing pretty well. But then when we stratify by race within Evanston, we can see that of all the major racial categories, white folks are the only ones who are actually doing better than the state or the country. Our Black Evanstonians are making less than half on median what a white household is. So again, looking by neighborhood is essentially also looking by race, but it's important to pull both of these out to really highlight how drastic these inequities are. And unfortunately, when we look at poverty and kind of economic status among children, this pattern plays out of economic disadvantage being concentrated in that Fifth Ward area. In the US, child poverty is about 19%, in Evanston about 9%. But then again, when we look neighborhood by neighborhood, we see that some of our neighborhoods are doing much, much better than this. And then, so areas where child poverty is virtually non-existent. And then in Census Tract 8092, aligned with the Fifth Ward and our formerly redlined community, we see that more than 1 in 4 children are living in poverty. We can also kind of look at the physical environment around us and how equitably we're distributing green resources. And so this map looks at our tree canopy cover across the city. The percentage is the proportion of land that could be covered by trees that is. And so we can see that, again, on the north side, we're doing pretty well with our canopy cover along the lakefront. But then in our Fifth Ward and formerly redlined neighborhood, and kind of all throughout Western Evanston, we see real areas for improvement where we need to add a lot of tree canopy cover because we know that trees, in addition to being beautiful, really support health, quality of life, mental health, property values. And so there are a lot of benefits that go beyond just the beauty associated with our canopy cover. And importantly, we also have a lot of kind of disproportionate burden of industry in this area where we also have a dearth of trees. And so, thinking about this from an environmental justice perspective, this is really something that highlights an area that we need to work on physically. Another aspect that we looked at in this assessment is access to healthcare. So we can look at the proportion of folks who are uninsured. We look at community members below age 65 because at 65, folks, assuming that they are citizens, can get access to Medicare. And again, if we just compare ourselves to the national average, we would look good. But when we look neighborhood by neighborhood, we see, again, that there are very stark inequities related to insurance coverage and therefore access to care. So in formerly redlined Fifth Ward area, 13% of folks are uninsured. And then in the 8th Ward, we have the highest percent of uninsured community members. And then we can look at this by race as well, and we can see that both our Black and brown populations are disproportionately affected by lack of insurance coverage. And then all of this kind of comes together to shape the health outcomes that we see across the city. So again, rather than just focusing on these health outcomes, we really need to think about all of the things that we've talked about up until now that are really shaping these realities for folks. So one example is diabetes. So in the US, about 13% of adults have diabetes. Evanston is about half that. And again, when we look, same neighborhood, Census Tract 8092, the Fifth Ward, diabetes is twice as high as the city average. And this is true for almost any chronic disease condition that I have mapped. So for hypertension, for obesity, those kinds of things. Mental health is also an issue that was listed as a priority in the E-Plan. And I think that we could all agree that it was at a crisis level even before the pandemic and has certainly only been exacerbated. And we know that mental health, affects, arguably all of us, but is mental distress is disproportionately high among those experiencing economic distress. And that bears out in the numbers when we look at our Evanston map. In Evanston, about 11% of folks report experiencing poor mental health for at least half of the previous month. And then when we look at kind of how this differs by neighborhood, we notice that, again, our more affluent areas tend to have lower reported mental distress. We see the highest reports of mental distress in along the Northwestern campus, which, kind of might speak to the crisis that we're seeing among adolescent health. But is also, maybe due to awareness of mental health and comfort reporting that. And then the second highest place where we see reports of mental distress is, again, Census Tract 8092 in the 5th Ward. So very similarly high rates of mental distress that, again, are likely linked to experience of racism, other hardships, economic distress. We can also look at kind of the burden of mental health and the racial inequities we see by looking at hospitalizations and emergency room visits. We can look at mood disorder visits within both the state and Evanston. And so looking at the state, so this is the mood disorder emergency room visit rate by state stratified by race. And so what we see is that already Black folks in Illinois have a higher rate of visiting the emergency room for mood disorders. There might be many reasons that contribute to this, but I think when we see folks going to the emergency room for mental health issues, we all know that that's not the best place to treat a mental health crisis, and could indicate a lack of better access to preventative or appropriate care. Could also perhaps reflect, over policing or kind of, resident dumping in the emergency room. So already at the state, we have some troubling racial inequities, but that really doesn't compare to the racial inequities that we see here in our own town when we look at this data. So what we can see is that for white residents, and this is stratified both by race and by zip code. For white residents, it's similar to the state. Hispanic, Latino, slightly higher than kind of the state rate. But for our Black community, specifically our Black residents of zip code 60201 on the north side, we have an emergency room visit rate that's much, much higher than any other community member. So 7 times higher than white residents. Really, again, kind of indicating, a lack of access to the right kinds of care. And then we can also look at mortality, and there are very staunch inequities in our mortality outcomes in addition to life expectancy. And I just want to note that like all of the maps and charts, these numbers are hard to look at, and really I think should be a call to action. Something that we should not be able to accept, and something that demands that we do better. So we can look at cardiovascular disease deaths. Again, when we kind of look at the Evanston average, we can see that for our Black community members, they're almost off the charts in terms of our cardiovascular disease death rate being much higher than any other community, any other major racial category. And in fact, in Evanston, we have a larger Black-white death gap on cardiovascular disease death than the city of Chicago. So we talk a lot about kind of racial inequities in Chicago, and I'm very sorry to say that in this case and in some others, we actually have a more stark inequity than the city of Chicago. We can also just look at premature deaths of all causes, so years of potential life lost among people who died before 75. And again, heartbreakingly, we see our Black residents are almost off the charts in terms of the years of potential life lost. And so over 13,000 years of precious life and wisdom that we've lost due to all of these inequities. And so all of this data, we looked at and talked to community members about and kind of came up with these 3 strategic priorities, as Ike mentioned. So first and foremost, I think, the obvious conclusion in this data is that we really need to grapple with the high level of racial inequity present in our community. So first and foremost, that will be the strategic priority moving forward for the health department, but for the entire community. Mental health, again, we see not only a huge burden of and growing burden of mental health issues in both our nation and the community, but then also, again, within that, very stark racial inequities in who is being served, and highlights areas where we can do a much better job in improving access to care. And then finally, climate resilience and environmental justice. This is something that aligns really well with citywide priorities, but then when we presented this information to the 5th Ward meeting, a lot of the conversation really focused on the need to focus on environmental justice and correct some of the wrongs that have been perpetrated in the 5th Ward area. And so these will be, again, priorities for the health department, but also another thing that's different about the E-Plan this time around is that while it used to be a plan just for the health department that we owned, we really want this data and these priorities to be shared by the whole community and to align this work with all of the other really important work that's happening across the community. So we know it's not just, it's not the health department that is going to fix racism or mental health. We really all need to align as a community around these priorities and work on them together and really own this data and the realities that it shows, and also own the solutions. So thank you.
Thank you.
Director, can you please join us at the podium? Kristen, thank you very much for the report. As I shared at the top of the meeting, that this is something that we've seen at City Council. I know that this is something that you've worked on in the beginning in terms of looking at these statistics. at the end of the comments, there's going to be a burning question of where do we go from here. So I just want to open it up for committee members to give some quick feedback, and then we'll open up to brief questions for the director. Did you go?
Okay, now it's women first.
True gentleman.
You have heard the facts about conditions here in Evanston. The only thing I want to thank you, ma'am, you've confirmed everything my grandmother taught me. Okay, having lived in Evanston all her life, moved from the highest economic community in Evanston to the poorest in her lifetime, and to see her unable to pass generational work and early deaths because of diabetes and overweight. We're standing now at a threshold. If we do not correct these inequities, basically we're encouraging them in this community. So I think I would like to see a policy come from your office to address these, especially mental health, which is my main priority, with stress, high blood pressure, and things that are affecting people. But secondly, some sensitivity and concern for everybody who lives in the borders between Isabella and Howard Street, and between the canal and the lake, are all Evanston residents. And if we can't have access equally to the kinds of things that make us a community, stop advocating in all your publications that this is a diverse, progressive community, when it is not.
Thank you, Mr. O.
Yeah, thank you for your comments. And this is the purpose of the E-Plan, at least the current one. In previous E-Plans, as Christine mentioned, was a document that was fashioned and planned, coordinated through the Health and Human Services Department that didn't necessarily have much of an input by the community. We are designing this plan so that we can incorporate ideas, concepts, initiatives, and also the respective city programs and initiatives that are implemented or going to be implemented in the future. So we have gone on the drawing board, we've had these conversations within the department on what programs do we want to see come into Evanston, or those that need to be improved in order to have a good or desirable health output. So as I mentioned early before the presentation, it is still a documenting process. We are still working on a number of initiatives which I think will be profound, which I think will be effective, that will be incorporated eventually in the E-Plan. So it's still a work in progress, and I hear your comments, and this is a document that we all want to work on together. It's just a view to showcase or demonstrate the health issues that we're having in Evanston through data, and this is not based on this is what this person is saying or this is what this other person is saying. This is information that pertains to raw data that is driving these health priorities that we want to focus on in the next 5 years.
Thank you, Director.
I want to thank you, Director, for your commitment and your attention to create this report. I'll say that I share really everything that Mr. Sutton said in the urgency and what do we do. And just reflecting on much of the information that was shared in the report, it's the same information that got us to this committee in 2019. Like with literally a 2-minute Google search, Robert Wood Johnson tells us our life expectancy gap, our household income gap, all of this. And since I shared that information in 2019, our household income gap was $45,951 in 2019. Today is $49,704. And so we have spent a good amount of time really digging in, understanding the data, putting it together in a nice comprehensive and coherent format. And it will take that for some people to understand and buy in. But we're now so far into this that I'm hoping not only your department, but others in the city other institutions in town do the same, but more importantly, come up with a solution. And we're trying really hard to do that here on this committee. We recognize from the feedback and the facts that we're not doing enough, but we can't do it alone. So first, I want to thank you for putting this report together. But it's more upsetting to see that since we made the commitment in 2019 as a city to do more and redress, that we have only declined and further failed our Black community. And so I'm just so grateful that you did this. I hope this report gives the visual and the data that some will need to really wrap around and support advancing our efforts. And the same thing about the environmental asset map. I mean, I'm glad that it's there now, but you know, we're in a state of emergency really as Black Evanston, and that may seem extreme, but if you're not living the Black experience and hearing from families that are leaving every day and can't afford any decent quality of life here, then you may understand sort of the emotion behind this. And so I would love to know, with you really setting the example for others, do you have a timeline on when you plan to produce solutions?
So the E-Plan, we are planning to finalize it mid-July. It will detail programs, objectives, some solutions that we know or that have been proven elsewhere and that we think can be tailored here in Evanston to effectively make impact into these issues that have been identified. So this is pretty much a nutshell of just providing data. The document that will be subsequently provided will include a number of programs. For example, we've been talking about the living room. It's going to be part of that in terms of mental health. We've been talking about having first aid, mental health first aid ambassadors. We've been talking about collaborating with the two hospitals in terms of mental health. So there are a number of initiatives that you will see in a finalized document that we're hoping that we'll start working on. And the plan is to also, through the identified strategies and programs, to form perhaps focus groups on these elements, even with the Reparations Committee, to start looking at these programs that are implemented or going to be implemented and start working on these items in order to make impact on these issues that we've identified. So these are things that we're still working on, but I promise you we should have a document ready to go by mid-July. And if you want us to come back to the Reparations Committee to provide the finalized document, we can do that as well.
Absolutely.
Thank you. I just have one more thing in terms of the solutions when you get there and how it connects into the work that we're doing on this committee. And just hope, and you mentioned that you would be partnering with the healthcare systems in town. In terms of the repair, much of that is going to be their responsibility with your direction and your findings. And so I don't know if you started those conversations with our healthcare systems yet, but it's always been a hope that they would step up. The community hospital closing, not having access, all that data is based on how the healthcare systems here in the city harmed Black folks. So while there is so much discussion here at a municipal level, there are the other institutions that are available, responsible as well. And if we can support your department in any way, I think we would all be very eager to support your department in making demands of the healthcare systems to support you.
Thank you.
Thank you. Ms. Barber, followed by Councilmember Reed.
I again want to thank your department for its attention and the adjustment and focus of the report. I sense that if you looked at, we saw household income, I sense that if you looked at net worth, the disparity would be shockingly expanded. It just is a statement. But my question is there a mechanism for community members to somehow engage in the solutions process? I think oftentimes we go along the way, and once it's you're further down the road, if an alternate idea, viewpoint comes up, it's more difficult to incorporate, and I understand that. So I wonder if there's a mechanism for community members to engage in the process even at these stages where it's not, I understand it's underway, but where it's not more fully formed.
Absolutely. Even though this information provided to you this morning is derived from data, we sought community members' input, as I mentioned earlier, through those who are professionals in academia, public health, our community members in various agencies, and that will continue. We don't hope for the document to be rigid, where we can't make changes to it as we go along or what fits in the fabric of Evanston. So there will be a number of opportunities for community members who are willing to contribute to what they think will work in advancing health equity, mental health, and climate change. So it's going to be a fluid document, so to speak, that will incorporate people's ideas and concepts that we know will be effective and progressive in what we're trying to achieve here. So once the document is finalized, we are going to have a number of strategies, so to speak, in which people can join in the conversation, people can join in the solution. It is not just a health department document, as it was previously. This is a community document that will be made available to the public. So we are open to people's input, people's knowledge, people's ideas on what they think will be incorporated to achieve our goals here.
Can I just add to that? One other thing that we're going to be doing is we want to put this data in the hands of every community member so that we can all own this data and act on it. And so that's one thing that we will be working on is really transparency of these maps and making them publicly accessible so that nonprofit organizations can write grants with, hard numbers demonstrating need, so that community residents can look at these maps and then come to public comment at City Council and really have the data behind them as they're generating ideas. And so I think that that's a very important part of the solution too, is by us not owning this data, but this is really data that everyone should have access to, so that we can all be advocating for solutions.
Thank you for your comment. Councilmember Reed.
Thank you. Thank you for that. As the former clerk, transparency and access to data is something I'm really passionate about and understand. So thank you, Director Ogbo and the whole team for putting this together. As former Councilmember Ruth Simmons said, this is data that, and as Carlos stated as well, this is data that the Black community has been anecdotally and aware of subconsciously, but I'm glad that you have it here in front of us in a well-organized manner. The one thing that I just want to say in context of this being, the Reparations Committee, one, I want to say that this is not, as you, I think, have both said, this is not on the health department alone. This is systemic throughout the city. And one of the things I think is really key with those redlining maps and the zoning maps being, overlaid and next to the maps now that show the disparities in health outcomes, is I think this helps make a case for direct cash payments. Because it shows that the outcomes are not just housing related. The outcomes are health related. They're a whole host of things, and just mental, and providing housing may have been the impetus, or the lack of fair housing may have been the impetus for some of these outcomes. But the solution at this point is we have folks who are 70, 80 years old and have healthcare expenses, and they need to pay those healthcare expenses. And so I think this data really helps make the case that, yes, the harm was caused from housing, but the outcome is far and wide, and the solution to that is also far and wide, and direct cash payments will help that. So that's all I have to say. Thank you. Thank you.
Thank you. clearly we're a diverse Black community that's here. I think that if there is a strategy of community meetings, I think we should look into that. And as a community, be a part of that solution. So I agree 100% with what our committee member Barbara states. So I would ask that we host this on our reparations website and then invite you back next quarter just to track the process. So thank you very much, Kristen, for your presentation and work. And
So
Director,
what we actually want to
Go
do
right
is,
ahead.
once the document is finalized, although the narrative is there, but we want to also back it with what the solutions we've come
Sure.
up with would be,
Yeah.
so that it's a comprehensive and complete document. So we can come back the next time there's a reparations committee just to inform you of where we are in the process. I'm hoping that will be done by then. But we would make it available, as Christine mentioned, to our community members,
Yeah.
agencies, the public. Our former e-plan is still actually on the city's website, which
Yeah.
actually needs to be taken down. But this information will be made available, and I'll feel more comfortable to make the information available to the entire public once it's finalized, so to speak. So,
yeah, it definitely underscores the importance of our work. Thank you very much.
I was just gonna ask if, in the meantime, and I understand this isn't final, but that this is so helpful for our work, if the slide deck might be available for the committee members?
yeah,
Thank you.
absolutely.
All right. Okay, we're gonna move forward. Is there a motion to please accept and place
So moved.
this?
Second,
It's been probably moved in second, and we'll continue to move forward. We still have another discussion coming up, which is the use of various revenues for fund for the city. And with us, we have our corporation counsel, Nicholas Reddington.
Good morning, members of the committee, Nicholas Cummings, Corporation Counsel. Just a couple of notes before we get into the discussion. I wanted to make sure that the community and the committee is aware of the distinction between the cannabis revenues that are currently funding the reparations fund and the city of Evanston's medical marijuana tax. They are two distinct, and this is important as we will discuss in a minute, because the city has its own tax on medical marijuana. There's a home rule tax that the city is allowed to levy. So there is a difference between the two. So it's not as if all cannabis revenues are going into the reparations fund. It is only the revenues that the state allows us to collect from our recreational use tax. One of the other things that is very apparent based upon the presentation that was just given, we have a TIF in the Fifth Ward. There's ARPA money that's flowing. Those are sources of revenue that can be used to address these various things in a race neutral way. And I use that in air quotes because we all know that in a segregated town, certain census tracts, we just saw the data, if you spend in those census tracts, it's more likely than not going to impact a certain group of people. But if that spending is done in a way that is not targeted specifically based on race, it's much likely much more legal. With those two things, we did prepare a memo that in short states that it's advisable that the recommendations of this committee or at least to the city council be that revenues that are discretionary or meant for discretionary spending is what we focus on to fund the reparations fund and not those that are meant for mandatory spending. That does not mean that the city council can't use funds from the general fund. I would not recommend it. That's all I'm saying in this memo.
And
So like the home rule tax, the medical marijuana tax, for example, the real estate transfer tax, those are home rule taxes that are levied, that are for discretionary spending that would be more advisable to be used.
And Nick, can you just take us down an additional layer? Because we've had this conversation, which started on council, and just for the members of the community that are here, I want to acknowledge you for the wonderful work and the leadership in the law department, as well Some of our committee members know that our law department recently received an award from the Bar Association based on the work that we're doing led by Nick. So I think.
Could you tell us about that award? Because it's a big deal.
It's a big deal. And then,
If I can, because we just have a
Please-
limited amount of time.
please don't
I'll make it
interrupt.
pretty.
Yeah, thank you.
Very briefly, and Councilman Reed is right, because I have somewhere else to be at 10:15 actually,
Yeah.
but the American Bar Association awards the Jefferson B. Fordham Award to a law department for local government for outstanding work in local government. And so the law department submitted, or the interim city manager submitted Evanston Law Department for its work regarding its partnership with the Reparations Committee. And so we were selected by the American Bar Association to receive that award. It'll be given in August at the American Bar Association general body meeting in Chicago.
The question, I guess, what I'm leading into now is for, and we've shared this over the years, I think it's important to note that all the steps that we take, we're definitely moving with a sense of urgency, but at the same time, I guess my generic words are, we want to remain bulletproof, because there are people, I'm sure within our community, definitely outside of the community, that are looking for opportunities to make a name for themselves and to slow the progress. So with that being said, Nick, you just remind us where we are in terms of once we open up this conversation. And I'm trying to find the words to summarize the caution that you are taking. And I think you said it, but I want to hear it again. Just the caution that we need when looking at outside funds that are more general funds versus dedicated funds. Thank you.
So the discretionary spending versus the mandatory spending, essentially, to try and put it plainly, mandatory spending is meant for city operations that benefits the general welfare and public. And so that expands the net for those that can claim discrimination on the basis of equal protection. As an Evanston resident who is expected to receive the benefit of certain dollars because they go into the operations of the city, if those dollars are now taken away to specifically give direct cash payment, for example, to Black residents, there is a possibility that person now has standing to challenge the program. Whereas if it's discretionary funding, and they may not have the standing, essentially. And taxpayer standing is one of the trickier ones in law. So that's the reason why we suggest using discretionary versus mandatory funds, but also the option of using those funds in a way that is race neutral to target certain areas that we know is more likely than not going to benefit certain groups of people, but you can still do it in a way that doesn't bring in a quote-unquote suspect class, as what the United States Supreme Court calls it. You can do it that way and it be just as, to borrow a term from the chair, bulletproof.
Thank you. Councilman Reed, followed by.
Thank you. So since we're using the kind of violent metaphor of bulletproof, I just want to remind folks that bulletproof does not mean you don't get hit by a bullet. It means that when you do get hit by a bullet, you live. So I want to remind folks that that's what we're talking about, bulletproof. So I have a question. Can you give an example of mandatory spending through the general fund? What mandatory spending do we have that's spent from the general fund?
The only thing I can tell you is I'm not the CFO, but based on our research, is this activity traditionally associated with government operations.
Can you give an example of something that is mandatory spending within the general fund?
Payroll.
What payroll? We're just mandated to have payroll in what sense?
I suppose you could choose not to pay your employees, but you would be in violation of state law because it says that the city council shall approve the expenditures of the municipality. So the expenditures of the...
Well, no, hold on. Well, payroll, obviously once we hire an employee, you have to pay them if you hire somebody, but if you don't hire the person, you have to pay them, so.
Also the bills of the expenditures of the city.
I think you satisfied our committee.
No, hold on. Because Bobby, well, I don't want to cede my time, because, but
I'm just gonna jump right back to you, but I just want to say that just the question is, does it make us less likely to lose in court? That's the question. Whether we open it up to more people with standing or not, to me, as a council member, doesn't matter. The question is, if it's not bulletproof with the standing that is currently in place, it's not gonna be bulletproof if we open it, if more people have standing. So the question is like, is this current way in which we're providing reparations race neutral or not? It was my understanding that it was by, if you look in the guidelines, there's an option that says if you can prove,
And that, yeah, that's where it's
right,
going.
if you can prove that you were discriminated against, no matter who you are, based on housing, I think is what it says, then you still qualify for this program, which to me would make the race neutral. So I want to make sure that we're keeping our eye on the ball. Just because it opens it up, just because more people have standing does not mean they'll be successful in court. Nothing that I've seen in this memo or been provided offline by Council Cummings, and I appreciate his counsel, his ongoing counsel of the city, but I haven't seen anything that suggests that people will be more successful in court if we use general funds, which helps us expedite the solution. I want to look back to what we just were presented in the Health E-Plan. Like, the solution is to try to expedite the solution, and the way to do that is to not wait on the cannabis use tax, but to use surplus funds from our general fund in order to provide the amount of funding we need so that we can expedite funding to the beneficiaries, especially our ancestors. So that's my question. It's like, does this, I understand that it provides more standing, but does it make it less likely, does it make it more likely that they would be successful? That's my question.
I can't answer that question. The only thing I can tell you is that it would make it more likely that a court could determine that we have violated equal protection by taking money away from the general welfare and spending it on something that is more of a suspect class, unless it is designed in a race neutral way. So if it's targeted to certain census blocks, like I was just discussing, most of the programs in this country that they're based on low income, right? They have substituted income for race, because it's more likely than not that the lower the income, it's likely that they are not white. And we just saw that in the presentation. So if the program is designed that way, we should not have a problem, you're right. But if we are focused on making it directly to impact a certain group of folks, i.e. black people in Evanston, and the program is only built for black people, then it can be problematic. And yes, we're more likely to be found to have violated equal protection.
I'm just saying, we
using
have not done that with this program. I just want to be clear. And if I'm wrong, we should know that. But the fact that we added that option means that I thought we were making this race neutral. We should not have this issue.
Is that correct? That we designed the program in a race neutral? There's wisdom from the committee that created the program to design it, yes, to disproportionately impact black folks, but it was designed in a race neutral way. Is that correct?
It was designed to primarily benefit those ancestors and descendants of black people, and we added that catch-all so that we could make it more defensible, yes.
So the program is
Since you want me to say that out loud in public, yes, that catch-all was added so that if someone tried to sue us, we would be able to say, oh, it's not race-based, but the primary guidelines were to benefit black ancestors and their descendants.
Yeah, I just have one legal concern. The city of Evanston has voted to support a program called Reparations. It seems to me that the discretionary funds are insufficient to implement this program. Why could you not, as an attorney, investigate other means like surplus income to invest in this committee so we can make a commitment that the city has kept 400 people qualified for some kind of reparation. We've only given out 16. 10 years in the program, we've already gone through 2. I don't see how you're gonna give all the rest of those people a promise that the city made from the funds of the city without having to go to other resources. I don't see how you're gonna do it.
So the memo was an investigation into the possibility of using other discretionary funds, and the recommendation is that the city can use other discretionary funds. We're not saying that we can't use mandatory funds. We're just saying we're just recommending not to do so. So, using surplus from the general fund, If that's what the city council wants to do, my job is to give advice. I'm a consigliere, that's it. I don't vote. So if the council wants to do that, that's certainly fine. And it's my job to advise what happens, whatever comes next.
I just want to jump in and just really quickly state that this was projected, the funding for this program was projected with an expected 3 dispensaries. So maybe in our next committee meeting, we can get an update on what's happened with the state of Illinois, where we are as a city with the additional 2 dispensaries, and how that might help fund. But then next I want to say, like I work a little differently. Like we have a professional staff. Nick's not a volunteer. You know, we pay him very well to do an excellent job. And in that, I really look to Nick for direction on how we can have a legal framework that is viable and not these programs that are aspirational. And so I'm okay with taking the direction of our corporation counsel while he continues to work and push. Other legislation might need to be changed at a state level, at a federal level. Those things might need to happen for us to get where we all want to go together. And I also want to say this like debate about cash benefit or not, like I don't think this committee has ever been against it. We're taking the direction from our corporation counsel to stay within a legal framework that is viable and also have a remedy in direct correlation with the harm. We're seeing that the harm is all over the place. And so I think that we should, one, pause and make a formal introduction or invitation to the other institutions in town to step up and join the reparations movement, while also giving Nick an opportunity to keep exploring how we can expand it. If we're saying we want general funds and he's saying he doesn't advise it, like he's who has to defend us in court if we get to that point. So I don't know how, if there's more research that you need to do or further expansion of your memo for you to change your position on that. If that's your position, then I don't know if I'm hearing my colleagues say we need to push that position or that you have some other legal ideas on how we can work around what our corporation counsel's advisory memo is. I'm just not sure where we're going with the conversation.
Can I just say, and I don't know because I'm not Hitesh, I don't know what taxes fund the general fund,
I
right?
can tell you that.
Okay,
No, hold on one second.
Well, I'm happy
Before we can invite him back to the meeting and thank you for being prepared to provide that position. I'll be mindful of the time and I think I want to.
I asked for a memo on the viability of using the graduated real estate transfer tax. Was
Yes.
that in there? I'm
Yes,
sorry.
that was.
Okay, I'm sorry.
Okay, and I think just I want to underscore and support what you're saying. And from our previous council, we knew that the resources from our public funds was not going to be enough to repair our Black community. So I'll say it again, we understood that the resources, whether it's from cannabis or what we can provide through our local municipality is not going to be enough to solve all the issues, particularly that we just seen. And I think that over the last 2 years, we have had partnerships with, and I can't remember the name of the organization that was working with some, that were doing the cash payments. We are currently working with Northwestern University to finalize a cash payment program, although we understand that it's not going to be solely directed to Black people. Again, it's a start. And I think that what Director Obo and his staff shared before, the continued opportunities to push our nonprofits through grants and other things to help to provide that support is definitely something that I'm speaking, from a position of counsel, I would like to see. I'll make this final statement, and that is, we have a lot of work to do under some real extreme conditions. I do not have the appetite to deal with this and be progressive and continue to work and then get diverted by a sand trap that might put us into legal trouble. So if it was and I'm going to agree with you what you're saying in terms of supporting our corporate counsel, the things that are going to get us into legal binds and slow us down and distract the resources from being progressive are things that I would want to try to avoid at this point. And again, continue to explore other opportunities and call our other partners to the table who have an investment in our community.
We've had concerns as a body about that before, especially on whether or not the direct cash benefits or even this program would result in a tax obligation. And then we went out and got outside legal opinion on that, and we're still waiting on the
Two
two
more.
remaining, but the one said it wouldn't. And so I caution us to try to frame this in a way of those who disagree with our counsel not trusting him, but people get things wrong all the time. And that's why I think we consult with outside legal counsel from time to time to get other opinions. And so what I'm saying is somebody that has taken every time Council Cummings or any of our staff writes something, I read it, all of it. And so what I'm saying is very surgically that I have not seen anything that suggests that we would lose in court. We might open it up to more people that have standing, fine, but we won't lose in court by doing it. And I have not seen or heard anything today that suggests otherwise. So that doesn't mean I don't support our corporation counsel. I talk to Nick all the time. He would probably even agree, and I appreciate you picking up the phone on weekends and times I probably shouldn't be calling him. And when he's on vacation, me and Nick have a great relationship. That being said, there's room for disagreement. That's what we're here to do.
I'm sorry you feel defensive. What I'm asking is how do we, if what he's saying is not satisfactory, do you want him to get another report? Do you want to do more research? How do we move beyond that? Because he's made his position.
Yes.
So then give that direction so we can get that.
Part of, this is a democracy, this is a committee, he is an advisor. I have questions based on his advice to get a deeper understanding of both clarity for myself as someone who spends hours and hours and hours doing legal research on tons of issues, has a fairly deep understanding for someone who is not a lawyer of the law, and I have some questions for our corporation counsel about this determination. And when we talk about things like mandatory spending, and we're so concerned about that, but we can't name a single mandatory spending item that is mandated. We're not even mandated to have a police force. Our police force is funded. If I can add, what's cut off earlier.
Just with all due respect, Councilman Reed, I think this committee meeting is not the place to have all your questions answered. I think that in the spirit of time, in the spirit of what this committee is for, that we do need to stay focused and that there is another.
I'm sorry to interrupt, but I'm going to take my time back because I'm trying to be laser, hold on, because I'm trying to be laser focused.
No, I know.
I know,
So
I'm just saying that, there is another way to do that. And I don't know that this time at this committee meeting at 10:30 is the time to do it.
Well,
we have 3 minutes left. Please go ahead.
Please give it all to Councilmember Reed.
Yes.
3 minutes.
all right, thank you. So we don't know, we can't name any specific items that are mandatory spending. Okay, so, and my research shows that our police department isn't mandatory spending. Many of the services that we provide are not mandatory or mandated by any state law.
You are required to fund them once you establish them. So if the city council votes to disband the law department, yes, you don't have to pay
Right,
payroll.
so
for
it's
the law
not
department.
mandatory. But of
Correct.
course, once we create something, yes, we have to fund it. That's
It becomes a service to the community.
right, but we
Once
can
you create
get rid of that service, or we can change the level of service, we can make any kind of adjustment. So it's not mandatory spending from our general fund. I can't look at anything in our general fund and say that it is mandated by state law that we provide that service that's spent from the general fund. If you can point to something that is, I'm happy to hear it. Two, you mentioned in your memo, you mentioned the concern about the transportation tax. You mentioned the county lawsuit, the lawsuit against Cook County. Can you just very quickly describe, that lawsuit was about what?
The county was trying to use a tax that's meant for transportation to basically go into its general fund. And the Illinois Supreme Court said that both the county and local municipalities, including home rule ones like Evanston, cannot use tax dollars that are meant for transportation.
Why is that? The reason why is Article 9, Section 11 of the Illinois Constitution that says transportation funds can only be used or transportation taxes, fees, and fines can only be used for transportation costs. So that is a very narrow, very specific ruling that has nothing to do with what we're talking about here, because we're not looking to use the motor fuel tax for reparations. We're not using, so it's Article 9, Section 11, transportation funds. So I'm curious, again, so then going further into it, I'm curious what you mentioned taxpayer standing. So what are the cases that dictate taxpayer standing?
Let's see, Marshall versus County of Cook, 2016 ILAP first 142864, talks about the first district case in 2016. Barber versus City of Springfield, 406 ILAP third 1099, fourth district case in 2011. It talks about taxpayer standing in state. I'm sure you want to look it up and read it. That's why I gave you the citations.
So what I have here is, the first case that said.
I'm going to respectfully ask this in an
All right,
interest
well,
of time.
I've-
if you can.
Well, I mean, we could have this debate offline, but
That's what I would
publicly, we
encourage.
would like to have a debate between two black men in the Reparations Committee, one who's a lawyer.
Yeah, because we're trying to get this right, so we make sure that
So
people who are
that's why
in our community are getting the funds. We have people who are
Gentlemen.
70, 80 years old
Gentlemen.
who are waiting for funds, and we are being
That's why we do it
delayed
private.
because of misinformation.
That's
why we
We
do it
are
private.
perfectly legally able to
Gentlemen.
transfer money from the general
Then do
fund
it.
to the
Then
reparations
do it.
fund.
Gentlemen.
They do it, and Jenner and Block will represent us to defend the law.
We'll have a good law firm representing
Thank
us.
you all. So, just in an interest of time, and I can always appreciate the passion and discourse around this subject. Corporation Counsel Nick, I want to thank you very much for your presence. I know that you have a 10:15 meeting. To the members of the public, I want to thank you all again for coming out and being a part of this conversation. Seeing no additional items in front of us, this meeting stands adjourned. Thank you.
With regard to black folks, because I'm 93, and anyway, the point is that we forgot one important thing in helping the community hospital. I was part of the group that forced Evanston to let black folks get to the Evanston hospital. We couldn't go to the Evanston hospital. The other point is that in my freedom plan, I included health as something that should be dealt with. I included education. In other words, we can't just focus on one particular aspect. I agree net worth is an important part of a person's wealth, but we have to think about reparations as reparations. A very important thing, though, is that I consider myself a Marxist, but
Is Marxist?
a Marxist,
Okay.
Karl Marx. Das Kapital was a evaluation of capitalism. It wasn't about communism. The point I'm trying to make is that the things that I set up in the freedom plan are those things that will help sustain the thing more than a Mexican hat dance. When we danced on hat one time and we're happy. The thing is that this particular racism has gone on for centuries. So we have to think of something that's very stable, not just a temporary happy thing. I got $25,000, so I'm happy. The point is that the funds for this kind of effort cannot just be the city. It has to be attractive enough so that people will donate to it and so it will last. Because if we just think about the city, there's not only politics involved and discussion about what's right and what's wrong, there's also the fact that it's limited. And I'm telling you that this is set up as a capitalistic project. So a venture capital thing with a real estate investment trust. It'll last forever because people will invest in it if it's run right. People will invest in it because it's just like federal bonds. It'll be there for a long time. And we were discriminated against, and racism is systemic. So we have to set up a counter system that will last for a long time. So I beg you to look beyond the city and to think of ways where this thing can last for another 93 years. Thank you very much.
Thank you very much, Mr. Johnson. That was the only name that I received. Was there anyone else in the crowd that had a comment before we adjourn? Ma'am?
Hi,
Hi, this is my first time
Please.
attending the meeting.
And do you mind do you mind stating your name?
Sure, I know.
Please.
My name's Yvette Lucia. I am an Evanston resident. I've lived here for 30 years. I wasn't born and raised here, but I do have family members who have been here for generations. And I just want to thank the committee for the work that you're doing. It's necessary. And I was just moved by what everybody had to say. I think you also have a right to say what you have to say, because there's so many things that have to be fixed. But one thing that I would like to see is, like, as a part of the solution, instead of us relying on a system that broke us to fix us, can we think outside the box for the solutions? I mean, our young men, can we take them back home to clear their minds? I mean, what can we do beyond the system that broke us? That's my question. Because we're looking for a system that broke us to fix us, and I don't think the programs are gonna help, to be honest with you, especially, I wasn't moved by what the health department had to say at all, you know? So how can we go outside of the box and create programs that's gonna heal us and help our young children?
At public comment, we don't give feedback, but can I talk to you after
I
this
would
meeting?
love that conversation.
Thank you.
Okay, but I just want to say thank everybody.
Thank you
Thank
so
you for
much.
your
Thank you so
comments.
much for your
And
comments.
I will be back, because I
Please.
was just moved by everybody here.
Please, and there's a lot of information for you and others if it's your first time here at the City of Evanston .org, and all you have to do is hit the /reparations in the search bar, and you'll get a really good deep understanding of all the work that's been done for the last couple
Okay,
of
and I
years.
just wanted to say thank you to everybody.
Thank you so much, well received.
Thank you.
All right, seeing no additional Miss Giles? No, she's not. I think she's the last one.
I know I'm coming at a time, I came to the first meeting, I was disappointed, and I'm here again, I'm disappointed because I'm not saying anything about anybody who's here, but the first meeting when there was no plan made for the whole population that had experienced redlining, and it's still not being done. I'm really disappointed because it's something that needed to have been done, and it has not been done, it's not being done, and it's not planned to be done, that I could see.
Thank you. Seeing that it's our last comment, I just want to thank everyone, acknowledge the mayor for his presence here at the meeting, and we look forward to seeing you next month. This meeting stands adjourned.